We are live.
Okay. So good evening, postgraduates, and welcome to this 81st episode of All India Postgraduate Teaching Program, which is an initiative from Academic and Research Committee of All India Ophthalmological Society. We call this PG program a program with a difference because we try to cover the uncovered aspects of teaching program in other PG teaching programs. Like, for example, we have case presentations, journal clubs, OSCEs, and very rarely do we have a didactics on topics which are not comprehensively available in textbooks. So carrying forward the tradition, we thought now the new postgraduates, the new fresh batch of postgraduates have joined from this January, and it was time for them to hunt for the thesis topic. This thesis topic probably is the first ever research thing which they are going to do in their ophthalmic career. And so it would be an ideal time for us to inculcate and to help these postgraduates in understanding how to choose a topic. And this is how in the month of February, we decided to have this particular 4-episode series on navigating the path to a successful thesis, which can become a comprehensive guide for postgraduate thesis writing, and which can be anytime referred by any postgraduates in coming years and understanding how they should proceed. So today is the first episode of this, and today we are going to understand the basics of thesis work. And today's topic includes what makes a good thesis topic, identifying research gaps, types of research, and role of mentorship. So we are very fortunate to have the senior most faculties from across the country, Dr. Muralidhar Ramappa, who is a head of cornea services at LV Prasada Institute, Hyderabad, Dr. S. Kavita, who is head of glaucoma services at Arvind Eye Hospital, Pondicherry, Dr. Vivek Gupta, who is an additional professor and community ophthalmologist at RP Center, AIMS, Delhi, and last but not the least, Professor Vishali Gupta, who is a professor at Advanced Eye Center, PGI, Chandigarh. So I'm really thankful to all the speakers for accepting this proposition and sparing their valuable time and digging out in details for this particular topics which they are trying to cover. Of course, my special thanks also goes to all the discussants, Dr. Rohit Khanna, who is a network director at LV Prasada Institute, Hyderabad, and who happens to be my schoolmate as well as Professor Dr. S.S. Pando, who is professor and head at Advanced Eye Center, PGI, Chandigarh, Professor Adib Alam Khan, professor at Institute of Ophthalmology, JN Medical College, AMU, Aligarh, and Professor Dr. Sanjay Kumar Daulat Thakur, who is head of the department at College of Medicine and Sagor Datta Hospital, Kolkata. I'm extremely thankful to each one of them for sparing their valuable time for our postgraduates. So now, without much ado, can I request our member ARC from Center, Dr. Deepak Mishra, who is also an additional professor at prestigious Banaras Hindu University, to carry forward the proceedings of today's program. Over to you, Deepak.
Thank you, sir. So we move toward the first topic, that is what makes a good thesis topic. And we are lucky that Dr. Muralidhar sir will going to give us few important tips on how to select or what makes a thesis topic good. Sir, kindly share your PPT.
Yeah, can you see my slides, sir?
Yes, sir. Yes, sir.
Yeah, outset, I would like to thank Dr. Prashant for giving me this opportunity. And it is commendable, people are doing a 81st ERC program. And I can't thank you enough for making me part of this. So what makes a good thesis topic? So it's one of the very challenging tasks, choosing a right thesis. So let's see how do we unfold. So the purpose of thesis in a medical dissertation is that, it will enhance the critical thinking and research skills, to inculcate, the clinical knowledge, and bridging, gap between the theoretical and the real world scenario. And of course, overall professional development. It's not just evidence-based medicine. So they should be able to apply, the evidence-based medicine in each and every case they confront in their clinic, and of course, contribution to the field. So we should never underestimate the potential benefits or effect of our thesis. It can have sometimes, the change, or it can influence the way we've been managing certain conditions. It also helps in mentorship and a collaboration, so they may have additional benefits will come to each one of them, and it does enhance the learning curve. So how do we get started? Choosing the right, the meaningful thesis is a difficult decision, as I said. And there are many tips. How do we narrow our thesis topic? Invariably, a good thesis comes from the clinic. I'm a big proponent and a believer that whatever current practices we are doing, it may be a new perspective on an old disease. It could be a clinical sign, or it could be investigation, or it could be new treatment modality, or testing between the two treatment. So defining the question is very, very important. So this comes with a lot of maturity. You would need definitely, some guide, mentor who can help you to choose an appropriate, thesis question. The question is the most powerful. So how do we dissect? How do we construct, such a question? And it also incite, the interest in the candidate. So how do we get that question? How do we narrow down that question? By extensive literature review, interacting with the colleagues, and attending various meetings. It helps to either broaden their topic or help dissecting their topic, and keeping the greater detail to the small detail, big attention to each of those detail that help in coming to the framework. And what are the components of a good thesis? It should be virginal, it should be relevant, and it should be feasible within that stipulated time period, and they need to have a clear-cut objectives. So it need not to be very disruptive and a new invention. As I said, it is a new perspective to the old existing problem. And your research should, stand out. It's just not the basic requirement of your residency program, and it should enable and bring out something new thing, path-breaking, which can enhance, everybody's knowledge. Ultimately, the patient should be beneficiary of such a original research. So how do we, strengthen our idea concept? By extensively reading. So the many people get an idea, similar idea, and what we may think it is a novel, it must have been published, elsewhere. And it is so important to, extensively read and also engage in academic discussion to identify what are the potential gaps. And it should be relevant, and it should be very current, and it may have an impact on the way we deal with the patient. And it is also very important to know the prevalence, the regional health concern, what are the technological bandwidth we have in an institute where you are pursuing your research, and also importance of organizational priorities. Can this be realistically completed with the available resources? It includes, your mentor, data, patient, and many things actually comes into, thesis, right from statistician to there are several technicians if you are running or using, some of the diagnostic modalities. And do you have an adequate funding and equipment and so on? So this has to be realistically planned. And it can be a very simple question. It need not to be very complicated. And, the recently in a Champali mod, the symposium, Professor Vaishali was speaking about how our question was so powerful. The causality for a serpiginous choroiditis led to so much of literature, and she went on to build her career and could complete over 370 publications. So that's a power of, choosing the right questions. And our objective should be very, very specific, clear at outset. And we need to have that, passion and aim to, complete that thing. And your thesis, question should be measurable. How do we define success of, that quantified or evaluated, the new study or a new drug or a new equipment? And can it be, realistically achievable? Do we have enough resources? And as I said, it should be very relevant to the field which we are pursuing, and it should have a clear-cut time frame for the completion. So what are the outcomes or the benefits of the right thesis, both at academic and a personal success? So it may lead to academic excellence. So this comes from the well-chosen, well-thought-out, well-dissected-out topic, and how well we have defined our question. It not only help in sharpening the clinical skill and does enhance the clinical acumen, and so is the research acumen. Can have an impact directly on a candidate career acceleration. So may have ability to pursue higher fellowships or can be a part of cutting edge collaborations. And overall, such a strong thesis can, contribute and change, the practice pattern. It can also help in questioning the prevailing dogma and help, drive the advances in healthcare. And also a networking and a recognition. A good thesis topic can attract a mentorship, funding, and opportunities to attend conference, and ultimately translating into publication. So it's so important to have a brainstorming with the entire committee, your mentor, and have a clear-cut mind map. So what exactly we intend to achieve. At times, too over-ambitious, poorly defined, objective, which a lack of relevant literature can be, difficult, to come out. And it's very important to have a balance, both academic as well as a practical interest. To conclude, choosing a right dissertation topic is a foundational step in your medical career. So it needs a lot of deliberation, thoughtful, and systematic approach to select the topic that not only fulfills the academic requirement, but also helps in future professional achievement. And of course, to complete, one has to have a motivation, passion, and a persistence, and also have a good strategic planning to complete. And, keeping end in mind when you start is so important. Thank you for your kind attention. I'll be happy to take questions.
Thank you. Thank you, Dr. Muralidhar. It was a nice topic, very well covered over it. And so, Deepak, okay. So we will be having the questions at the last only so that we can address in total all the questions. Meanwhile, we will be getting questions from our students also who will be texting it to us. So can we have the second topic that is going to be identifying the research gaps by Dr. S. Kavita, please?
So are my slides visible?
Yes, ma'am. Your
Yes,
slides are
ma'am.
visible and you are audible
Yeah.
too.
Thank you. Thank you. So my topic for the today is the residents is like identifying the research gaps. So I think by now the newly joined residents will be well aware of this research process in their dissertation. As a first and foremost step, they'll be preparing their protocol and then they'll be submitting it to the scientific research committee and then to the institutional ethics committee. And with the proper approval letters, they will be submitting their protocol to the DNB board or the university to which they are attached to. Apart from these things, I will strongly recommend the residents to register their protocols with the Clinical Trial Registry of India. This is because later when you come out with a good thesis, which you want to convert that into a peer-reviewed publication, some of the journals will demand the CTRI registration and you will not be able to register your protocols in a retrospective fashion. So as discussed by my previous speaker, the first and the foremost step is like you will meet your mentor or the guide, and then you will get acquainted with your thesis requirements as per the board you are attached to. You will discuss the possible topics and probably you and your mentor, with the help of the mentor, you will be coming out with a suitable topic. Now you have a topic at hand. But still, you might get lost, you might feel confused, unclear, disoriented regarding what next. The very next step is identifying the research gaps. For that, we need to understand what is a research gap, what is the importance of identifying a research gap, and how to identify this research gap. The gaps in the literature is nothing but missing pieces or insufficient information in the published research pertaining to a particular topic. which is like underexplored or totally unexplored, or which was previously explored, but the technology has become outdated, so that it provides opportunities for further research. Why should we identify the research gaps? It is because it will identify the current research, your research question, in the context of the available literature, and we need to justify whether doing the present research is like very important, or very it is like, is it needed, and how important is it to add on to the existing literature. Now we know what is a literature gap. Now we need to understand how to identify the research gap. So for that, first we should frame our research questions and identify the key terms associated with the research questions, and with the help of the key terms, identify the relevant literature and the publications. In these relevant literature and the publication, there will be like cross citations. Review those literature also and identify the issues that are not addressed, which will become our research topic of interest. So in what forms these gaps can exist? It can be a population gap. For example, it can be understudied demographics or a sample size. Methodological gaps. For example, a relevant RCT will be appreciated, but all the relevant literature, whatever is available, is like in the form of a retrospective study, or a methodology carried out might not be up to the mark. It can be a contextual gap. It can be a theoretical gap, or it can be an evidence gap. For example, evidence will be available, but the results will be contradictory. Some will be supporting a hypothesis and some will be against that. Again, we will be needing further research to prove what is really right. So as I said, we'll be reviewing the literature, learn about the literature, identify the gaps, and identify the research questions you want to answer. Based on your these literature search and gaps, you will draft your aims, you will write your background, and then expand or explore new topics. And later, your paper will add on to the existing literature. Now, we know it is very important to identify the gap, but we should know where to get this literature. So for that, we should get acquainted ourselves with the relevant databases, locate the relevant information, develop search strategies, recognize and apply useful features of the databases, and also we should identify the ways to manage the searches and references. These are the 7 best databases for research: PubMed, Scopus, Web of Science, Science Direct, Directorate of Open Access Journals, Directory of Open Access Journals, and the Journal Storage and EBSCO. These are some well-known databases for search. And we know Medline is a part of the PubMed, which is maintained by the National Library of Medicine. And the articles which are under the PMC will be getting full access to the text, whereas for the other articles, we'll be getting the abstract. Probably you have to have your institutional access to get the full text of many of these manuscripts. Now, we need to know how to develop the search strategies for having a quality search. So the first and the foremost question is to come out with the research question, and all the residents should be aware of this PICO method. I'll be coming out and describing what is PICO. For example, if I have a research question, can motivational cards really benefit the sibling screening of primary open-angle glaucoma probants? PICO is nothing but P is the population, which is primary open-angle glaucoma from the research question. I is the intervention, which is the motivational card. C is the comparison group, which is the oral counseling. And O, outcome, is the response rate. So these are all the key terms which I should use in the PubMed if I want to do the research. Now, in order to combine these key terms, what we have is Boolean operators. And the most commonly used Boolean operators are and, or, and not. So, and indicates a compulsory search. If I write primary open-angle glaucoma and family screening, it will show articles which includes both these key terms. If I write primary open-angle glaucoma or POAG, it actually broadens the search, and it will show articles either with POAG or primary open-angle glaucoma. Not really means it is like eliminating or excluding. If I write POAG, not PACG, it will exclude the articles with PACG. And please note, whenever you are using this Boolean operators, it should be in the uppercase. So for example, if I want to do a research or a dissertation on visual outcomes following manual small incision cataract surgery in lens-induced glaucoma, a prospective study. Here again, let's start the key terms by using the PICO. Population is lens-induced glaucoma, intervention is small incision cataract surgery, outcome is vision, and there is no comparison group. So I went to the PubMed, and then you can see I have written lens-induced glaucoma, and I have used the Boolean operator OR in capitals, or phacolytic or phacomorphic. So in order that the PubMed should consider lens-induced glaucoma as a single terminology, you should always use this double apostrophe. With this population-based search, so I got 217 articles. And then I searched based on the intervention, which is MICS or SICS or manual small incision cataract surgery. When I searched based on the intervention, there are 1702 articles. Now, based on the outcome, again, we can see I have used apostrophe for each of the item, and I have used the ORR, Boolean operator in the full capitals in order to search. And here we can see I have got more than 353,000 articles. The next step is just click the advanced button here. You will get this screen, and you can see 3 dots here. If you just click on these dots, you will be able to combine your population, intervention, and the outcome by using the Boolean operator and, as shown here. When you are using 2 or 3 different Boolean operators, you have to note here these are separated by using brackets. So now when we search like this, we can see it has come down to 8 articles. Now I have to go through the articles and identify the lacunae. As I said, the cross references in these articles will also be helpful. Apart from these databases, we have Google Scholar and the Cochrane Library database. When we are looking at the literature, the resident should be aware of this quality of evidence pyramid. For example, if you are getting 2 relevant articles, one is a systematic review or meta-analysis and other is a case report, you should give more importance and you should cite the meta-analysis and not the case report. So we should be aware of the quality evidence. So based on the literature search, now my resident has changed the topic as lens-induced glaucoma, clinical and demographic profile, status of the fellow eyes, and reasons for late presentation, a prospective observational study. Just based on the literature search, identifying the gaps, see like how she has come out with the lacunae in the literature. So reviewing the previous studies done on clinical and management of LIG. So most of these confirmatory data and the reasons for late presentations are lacking in the South Indian population. And most of these studies are done in a retrospective fashion, and many studies discussing on ECCE, no data, much data on SICS, and hence like there is a need for doing the present study. She is justifying the need for present study and comes out with the aims such as reasons for late presentation, to determine the status of the fellow eye, need for further glaucoma management in these eyes. Later, she went and published her thesis in ophthalmology journal also. One of my residents wanted to cite this paper in her dissertation. Now we see how we have to cite. So my resident is well aware that the third author is the chief medical officer of our institute, and then he has used she has used his name to cite the paper, and this is not the right way. We should always use the surname of the first author and et al. To cite the paper. For example, this paper should be Ayub et al. Again, we can see when we want to do the review of literature and cite the authors, we should always use only the surname and the et al. For example, here only Liu et al. And Rao et al. So for example, if you want to cite this particular paper, see my resident has conveniently taken the name which she is liking and cited this paper as Maria et al. But the right way to cite is Capote et al. So what are the possible challenges in these review of literature and identifying the gaps? There can be information overload, there can be bias in selection. Probably we'll be focusing more on the things which are in favor for us. There can be time constraints, and we have to keep ourselves updated. For example, when you start your protocol, there will be limited research. By the time you complete the dissertation and write your part 1 and part 2, there will be many new articles which have come up, and we have to keep ourselves updated with this information. How to overcome these challenges? You have to critically analyze, compare and contrast the available research, assess the study designs, get familiarized with the limitations of the available research. Whenever you are reviewing the literature and all the papers, there will be a strength and limitation session, which will become the lacunae in the existing literature. And also there will be no scope for future research in the conclusion paragraph. We should go through that and get familiarized to form the new research questions. And we need to focus on the research questions. And apart from this, don't reinvent the wheel. We have to consult the experts. To summarize, literature review is the backbone of the research. Identifying gaps ensures your study is relevant and impactful. Use structured methods and tools for efficiency. Regularly update your knowledge based on the recent studies. So this is the wall of fame. This is nothing but the residents from our institute who have published their thesis in a peer-reviewed journal with the impact factor more than 1. So when we do in a very much structured way with a good research strategy planning, this is very much possible. And best wishes to all the residents who have joined us for publishing their dissertation. Thank you for the opportunity. My sincere thanks to AOCARC for having me today.
Thank you, ma'am, for summarizing almost everything. Before we go to the next talk, I would like to ask one question from the Rohit sir. Sir, what is your favorite method? Means if some first year resident or anyone join at your institute, what you suggest as your tip to find out the research gap?
So probably I think the first thing is identifying, thanks Deepak for the question, and thanks Prashant and ARC for giving this opportunity. But one first important thing is finding a mentor actually. So probably I think when the resident join, they are totally lost. And as I think one of the speaker pointed out, you have to find a mentor first. So unless you have the right mentor, you will be totally lost because this is a ocean. And picking up a right question, people get lost and then look at old theses and try to see whether we can do the same thing and all. That will not work in long run. Probably it will get you to a certain extent, but I think if you want to go long, probably you should generate your own question. And as Murli pointed out, Dr. Vaishali Gupta looked at one question, and probably I think that question triggered her in her mind, and then she went down looking at that question in more details. So probably the seed should start from your residency program itself, and that and I keep telling our fellows and residents that what your mind will see, your eyes will see. If your mind doesn't see, then your eyes will also not see. Even if you have eyes, so keep your power of observation very. You should have good power of observation, because unless you pick subtle findings and then ask questions on that, why this is happening and why this is not happening, and if you have a right mentor, probably I think you will reach the right question also.
Thank you, sir. The best thing is to identify mentor and identify their sub-specialty. Means if anyone wish to do something with the help of their mentor or have any interest in the subtopics, then he or she can search or narrow down their search limited to that particular segment of that. We will take next question. Meanwhile, I request Dr. Vivek Gupta sir to present his topic, which is very important. That is the types of research. Means at least
Dr. Vishali would be going early first.
Okay.
Yeah,
And
please.
Dr. Vaishali ma'am, please.
Dr.
Ma'am is
Deepak,
going
can I
to.
make a comment?
Yes, sir. Yes, sir.
Can I make a comment, small comment?
Yes, sir.
The problem is usually the PGTs don't get to choose the mentor. It's the other way around.
Of course.
So it is a difficult task for PGT to choose the mentor. It is usually the mentor who chooses the PGT. And then what actually practically happens is that the PGT talks with his senior colleagues, third year PGT or senior resident, and try to find out what is practically possible, keeping the infrastructure in mind of the department.
It is not the mentor who is going to choose the PG. Can I say?
Yes, sir. Yes, sir.
Now you have
Yes,
seen here working in the Institute of Ophthalmology. Now it is not the mentor who will choose the PG. It is by lottery system only.
Yeah,
Yes, sir.
Who will get who?
There are
You are
many
not
other
aware
things.
of that. Then
Yeah,
you
there are many
prepare
other
the mentee for the thesis of your choice, basically. What is your subspecialty? Then you have to guide the mentee to go in that specific area, and he will come out with the topics of his choice, which can be done with the time frame allotted to him, 1.5 to 2 years, and the resources available in the same department, preferably in the same department, so that there is no much burden on the mentee. He should run around in the medical college and going from here to there. It should be available in the same department, and with the time frame prescribed for PG training. That is 1.5 year to 2 years only. That's what is the bit.
Very true, sir. Meanwhile, we will have more knowledge and more inputs by Dr. Vaisali ma'am on this thing, how a mentor grow or help and support the mentee, means the role of mentorship. Vaisali ma'am, please.
Thank you. Thank you so much, Deepak, for your introduction. Thank you, Prashant. And thank you, Team LVP, for your very kind acknowledgement. What I'm talking about is kind of the same, but slightly different from Champollion. So why do we want to thesis? We heard beautiful talks, how you do thesis, how you find a mentor. But what is important is, why do you find a good mentor? That is because once you have done your thesis, you just don't want it to be dumped in some clerk's office, in some dean's office, gathering dust. You want that thesis to be read, to be recognized, because publishing makes your work recognizable, but you cannot publish unless you have the experience of a good mentor combining with the enthusiasm of youth. You also want credibility. It was beautifully put up by the previous speaker. Dr. Muralidhar very well indicated that you just don't choose a topic which you just say it's not done in India, it's not done in North India, it's not done in Chandigarh, not those kind of topics because you are in your comfort zone. You want to do something which is creditable, and to get creditable, it's just more than collecting the data and making the Excel charts. Now, that kind of guidance will come only from your mentor. And of course, the career advancement, because if you want to follow a career in academics, then of course you have to move ahead. But to me, this is personally the most important thing, is to make a difference. Because we are all here to put a dent in the universe, howsoever small that dent is. It might just be a speck, but you've got to do something which makes difference to your patients. So what is mentorship? Mentorship is essentially a bridge which turns the potential into performance. And I think that is where mentors, matter. We are fortunate to be in an institute where our residents are encouraged to choose the guide. It's neither lottery, it's neither the turn-wise, nothing. Just the guides are there and the mentor can come and choose you. So let me share my story with you. I was presenting a journal club. I joined residency, and in year 1995, I was presenting a journal club. And there was a beautiful article from Dr. Biswas from Shankar Netralaya, and I discussed this article. This was a report of 5 cases from India where they had enucleated the eye, and they showed on histopathology that the eyeball was kind of teeming with acid-fast bacilli. So, I was very kind of like, really, they don't treat the TB of the eye and they remove the eyeballs because they could not make the diagnosis. And enucleation means you're making somebody blind because TB affects both eyes. And when we do the blindness is not the disease of the eye. Blindness is lifestyle change for you and for your family. And that is how my brush with overall intraocular TB started. So I was fortunate to have Professor Amod Gupta as my mentor. So I went to him. I said, it's very strange, like TB is treatable, and why are we removing the eyes of the patients who are having TB? He said that is because we are not able to make the diagnosis. And then he told me there is something called molecular biology and PCR Nobody has used PCR from the intraocular fluid. So you should go meet Dr. Shobha Sehgal, who was the chief of immunology, and see if she can do. Well, next 2 years, I spent a lot of time taking the samples from this, waiting outside Dr. Shobha's lab, just getting the PCR going. And this is my favorite painting, an experiment on the bird in the air pump. Now, this was the first experiment which was done to show that without oxygen, the bird will die. And this is what I want to highlight, the eyes of the person who's making an experiment. He's just looking ahead. He's not bothered by the reaction of the people around him. The reactions could be somebody who's scared, who's holding the forehead, like, what is this guy doing? There is a couple in the background which just doesn't care, and some people are curious. Why I'm telling my youngsters about this is because when I first talked about PCR, meetings after meetings, I had to hear a lot of stuff that you take a tap water and it comes positive for Mycobacterium TB. What are you talking about? But this is how we started. PCR just gave us a tool that, okay, these patients could have TB. These days, we don't need PCR because the phenotypes are so well described. So we did describe a lot of phenotypes: granulomatous interior uveitis, intermediate uveitis, tuberculomas, large granulomas, and the most important, serpiginous-like choroiditis. Before 2003, we were not looking at TB as an etiology for serpiginous-like choroiditis, so we were just treating them with immunosuppression. However, after having the PCR as a tool, we got the opportunity and we started showing that if you add ATT, the number of recurrences goes down. So starting with 1995, we just kept on working. And this remained my area of interest even as a faculty and this. Now, this was to me a landmark photograph. This is the day Professor Amod Gupta retired, and this is the picture taken at his home. So my part 2 of the story is like how from a mentee you become a mentor, because your journey should not stop like as a mentee. You should carry forward the legacy to the next generation. So where were we this time? This was 2015, the year Professor Gupta retired. Well, due to his efforts, TB was a very well recognized form of extrapulmonary disease, and we were all treating it, but not the physicians. If you look at the index TB guidelines, which came around in the year 2017, ocular TB was not even taken as a part of extrapulmonary tuberculosis. And it was a very humiliating experience for us sitting there and being told that you have most of the publications only from 1 or 2 centers in the country. Ocular TB does not exist worldwide. So I took up this challenge and I carried out a multi-centric study. It started with just 4 people, no funding. That's me, that's Carlos from Moorfields, Rupesh from Singapore, and Kwan from Stanford. So what we took 25 centers, and the most important thing was we chose 4 young people whom we mentored, who worked for us. We had not even a single penny to carry out this study. So these are 4 of the individuals: Dinesh from Singapore, and Carlos had Ilaria. I mean, all 4 of them, when we chose them, they were kind of at a phase in their career when they used to call themselves depressed, that we are not looking. So I'm very proud to say Dinesh today is consultant is SNEC, Ilaria is in Moorfields consultant, Anirudh is in Cleveland, Abu Dhabi, and that's actually my daughter, Sarakshi. She was working in Stanford at that time, but now she's a physician in Washington University. These 4 youngsters created a web-based platform without any money. So we allowed the people, not people, our investigators to enter the data, and you can see the power of mentorship. The first publication is Lessons in Digital Epidemiology from Courts, coordinating multi-central research, 10 countries using operational and technology to overcome funding deficiencies. And these 4 youngsters were there in publication after publication of Courts. I'm not there to highlight the thing, I'm just saying the power of mentorship. They continued with us journeys. This is Vancouver RO, where we standardized the nomenclature. And of course, we finally designed a very complicated Delphi. And it was again these youngsters which were sitting there at the back of the hall, taking notes. And you can see Ilaria, Sarakshi, participating, doing work, actually being guided, writing the proceedings minutes. Again, you can see those names everywhere. We did summarize, we did finally come up with my question that why do we have to remove the eyes for TB? And finally, we came up with the answer for the physicians that these are the guidelines where you have to give TB, index TB or no index TB. And I'm very pleased that ICMR has now included ocular TB as one of the recognized forms of extrapulmonary TB. We designed a very simple calculator, which you can have as an app, which will tell you when to give ATT. And this app was recently validated and published in JAMA Ophthalmology. This is my concluding. It's an open circle, there is a space for more. You get mentored, you mentee people, listen to each other and step out of your comfort zone if you really want to be a good mentor. So I think it's important for the PG students to do the literature search and not just ask your seniors who's the most comfortable one. I remember Anand Vinegar walking with us the first day and he says, I want to do ROP. I remember Anirudh walking to my office the first day that I want to. So, these are the people who shine, who are exceptional. But I think these were also the people who knew what they wanted to do rather than to be told. And I respect the institutes which have other systems. But I think if you are passionate, you just don't have to do your thesis. You can do things along with your thesis. Thesis is time bound. Life is not. Your passion is not. So you can always start working along with your thesis. Thank you very much, Team ARC, once again for giving me the opportunity.
Thank you, ma'am, for such an inspirational story. In fact, the journey you covered itself is very inspirational, both as a mentor and the mentee. Professor Adib, sir, one quick comment from your side on the role of mentorship.
Thank you, Dr. Deepak and AIUS and Dr. Prashant and the whole team for giving me this opportunity. What I observed over 25 years as a teacher in the department, when they join the department, they are perfectly new fellow to the ophthalmology after doing MBBS. Let him settle in the department for 2 to 3 months, and he should be aware of the surrounding and basic working and basic concept of ophthalmology. Then you ask them their interest, being a mentor. What is your area of interest? Keeping in mind my specialty as well. So that if I am from anterior segment, don't go to the posterior segment. So let them come with from the literature some topics of their interest and then choose one topic from there, keeping their interest in mind. From your area of specialty, just allot them that topic. But you have to tell the president what will be the impact of this topic. It should have an impact on the society, on the community, and for their career as well. Not simply going and doing thesis for a formality. You should have some clinical significance of that, which will be what will be the outcome of the thesis, which will be useful for the department, for the clinical research, and for the career of the individual. So that has to be, thesis question has to be very clear and should be addressed properly. That's my suggestion to you, to the residents only. They should have an impact on the community as well as the society. There should be a relevant topic. Don't go here and there and simply going the research. It's not my cup of tea, basically. And we have to make them grow and make them prepare them for the future challenges as well, not for this MS thesis only. In the life to come, as Dr. Vaishali has said, not only thesis work, they have to choose a career, and especially if they are in the research or teaching career, they have to make a further research as well. And so they have to prepare themselves for those challenges as well after doing MS. It is not only limited to the MS thesis only. That's my opinion.
Thank you, sir. Next, we will invite Dr. Vivek Gupta for his presentation on the types of research. Dr. Vivek, please.
Thank you, sir. I hope my slides are visible. And
Yes, yes.
Thank you. So thank you, ARC, for this opportunity. Basically, when we talk about research, so broadly, we would classify research on the basis of research methods. That's classically how you would see being classified as observational or experimental studies. However, another way I would also classify them is based on the setting in which the research is being done. Now, typically, most of the MD thesis that would be done would be clinical in nature. But coming as I am from a public health background, so we do a lot of epidemiological research in ophthalmology as well. Now, when we talk about observational studies, typically we have descriptive as well as analytical studies. Now, pure descriptive studies are very, very rare. I mean, you could basically what you're doing is you're just describing what is happening to a particular patient group or in a particular population. And case series and case reports are typically descriptive studies. Some cross-sectional studies wherein you are doing prevalence assessment. Okay, how many people in this school, how many children in this school are having myopia or having refractive errors or having, say, convergence insufficiency, color blindness, things like those. Those would also be your descriptive studies. However, normally you would not stop there, just saying that these many children have myopia. You would also try to say, collect additional data and say that, okay, do these children have do they have parents who are also myopic? Is there a difference across males and females? So you basically start looking at certain associations, certain inferences that you can draw from those studies. Another kind of descriptive studies which often get missed out are, say, new diagnostic tests. How much is the sensitivity? How much is the specificity? Say a new online perimetry has come out. So you want to say, okay, is it comparable to conventional HVF or not? So those would also fall in this ambit. Now, another kind of descriptive studies that we often do are economic studies that we do in public health. So how much is the patient cost? How much is the societal cost? How much is the hospital cost for, say, treatment of cataracts or comparison of treatment of cataract using SICS versus phacoemulsification. So economic analysis can also fall under this ambit. And then we have case control and cohort studies, which are your typical analytical studies. So I have already spoken about cross-section studies. Some more examples would be, for example, we did the National Blindness Survey. So looking at, what is the prevalence across districts, across urban, rural areas, things like those. If we talk about the analytical studies, so students often get confused about case control studies and cohort studies. Is my study design that I'm going to adopt, is it a case control study or is it a cohort study? Now, in all such scenarios, I just advise the students to think about, okay, how are you defining your groups? Are your groups being defined on the basis of whether they have the disease or they do not have the disease? And then you are looking at risk factors? or your groups are defined that, say, group one is having, say, smoking, group one is non-smoker. So if the group is defined on the basis of risk factors, then it is a cohort study. If the group definition is on the basis of disease present or absent, then it is a case control study design. An example of a case control study would be, for example, you're sitting in the clinic and you're seeing patients with sight-threatening diabetic retinopathy, and now you want to explore, is there an association between history of systemic comorbidities, a patient having hypertension, a patient having dyslipidemia, chronic renal failure, is that associated with vision-threatening diabetic retinopathy? So, you know, so you will start with patients with VTDR, without VTDR, and explore what proportion of patients in each group have systemic comorbidities and run your analysis. Whereas in a cohort study, for example, we did this study about incidence of myopia in school children. So we identified school children who did not have myopia, and then we compared how many of them developed myopia over the year. Now that was kind of a single group cohort study. Okay, we only have children and we are looking at incidence, but we also took a step further and we said, okay, let us compare incidence of myopia among children who were doing significant outdoor activity versus those who were not doing outdoor activity. So our exposure was doing outdoor activity, our non-exposure was not doing outdoor activity, and then we compared incidence of myopia among them. So that's an example of a design of a cohort study. Our groups were defined on the basis of risk factors and our outcome was incidence of myopia. The main difference between a cohort study and a trial is whether the intervention is being are you giving an intervention, or the groups were formed naturally. So outdoor act in our study, we did not tell our children to perform outdoor activity, right? We only assessed how many of them were doing, how many were not doing. Whereas in an RCT, what we would do is, like, we'll take 10 schools, 5 of them students will increase their outdoor activity, 5 schools, the students will be performing routine activities, whatever they are doing. So the basic difference is now we are controlling the intervention. So that is the hallmark of a randomized controlled trial. Now you can have non-randomized trial, you can have non-controlled trials, and a huge number of variations. You could be looking at new drugs which are coming in. You could be looking at new surgical techniques which have come in. You could be looking at new protocols of administration of existing drugs or existing surgeries. You could be looking at preventive trials or risk factor trials, cessation experiments, and in community-based studies, we also look at behavioral interventions. An example which I just gave you about the physical activity, outdoor activity, and myopia. Now, I would like to, conclude by pointing the students towards some of these guidelines. These are available from the equatornetwork.org website. And how these guidelines help. Like, these guidelines are about reporting. How do you report a study that you have done? So there are, if you can see in this image, you have randomized trial guidelines, consort, you have observational study guidelines, tropes, and you have a whole list of guidelines. Now, just opening up, for example, the trope statement. This is a checklist of items that should be included in reports of observational studies, describing morphology of, say, retinal findings in patients with ocular tuberculosis, like ma'am just mentioned in her previous presentation. Now, how this would help, reporting would be at the completion of your thesis when you're finally writing it up. But what it tells you is, whenever you're writing up your protocol, whatever are the methods that you need to include within your protocol. So you need to create your protocol in headings of, say, study design, setting, participants, variables, data sources, things like those. So it would be a good idea to just review these guidelines. Many journals actually ask you to include maybe a checklist along with your manuscript. Some ethics committees also ask that, okay, along with your submission for ethics, include a completed checklist of these guidelines. So be helpful if you are aware of these, and these will, help you clarify how to structure your protocol. With that, I would stop and happy to take questions. Thank you.
Thank you, Dr. Vivek, for summarizing things in a fixed and short way. Sir, Sanjay Thakur, sir, my question to you. A newly joined resident didn't know anything about the research, means almost whatever the retrospective, prospective he had read is only in the PSM department. So how you suggest or what is your uh, tips for him to identify or go and find out whether he's going to do which type of research or what is the research methodology of his synopsis? Because writing a abstract first is you have to write down the synopsis, then he will going to publish the thesis or submit the thesis. So synopsis writing for an ethical clearance, what are the things you suggest that any PG can take care of those things which are related to the research? Sir, you are muted, Sanjay sir.
Yes. First of all, I would like to thank Team ARC, especially Dr. Prashant, for inviting me for this webinar. Now coming to the practical situation when a new student comes for the first time in the department. Recently, a first year student has joined yesterday in my department. So what I suggest, as has been told by previous speakers also, that you have to first familiarize yourself in the department for a couple of months. See what's going on, what is the infrastructure, what are the possible things in mind. Then I ask the student to search for a topic which is of interest to that resident and then make a list of topics. And I also suggest consult your seniors who will help you because you are new. I can tell them you go to the PubMed, you can do the research, online search for these topics. But practically, it is the senior PGTs who guide them at home with the desktop how to make search. And then he has to do a lot of networking and find a topic which is of interest to him and make a short list. And then I usually tell them to do something prospective. I avoid the retrospective studies.
It's very good.
Sorry?
Correct.
No, sir.
Yeah. So prospective studies, if it is observational or interventional, both are good enough. So whatever is comfortable within that time frame, within the infrastructure, and what is of interest to the student, that is of main concern. And the whatever thesis or topic he chooses, the objectives should be clear cut. It should not be confusing. Very clear cut objective so that when we analyze, we know what to do the tests and what to come out with. So it should not be confusing, and then let him do the thesis on that topic.
Can I ask a question to all the topmost institutes which are represented today on this forum? This is exactly what Dr. Thakur has spoken. We have gone through the same thing. But when I look back upon the day you enter a postgraduate department, within first 3 to 6 months, you are supposed to choose your thesis topic. When you are naive to the whole concept of ophthalmology, you have not read anything beyond, a book called Parson or some Indian versions of it. And then you are supposed to know it. So it is definitely a daunting task for a postgraduate who really does not understand what is slit lamp and he's fumbling understanding a cataract, seeing a cataract on a slit lamp, seeing a retina with a direct or an indirect ophthalmoscope to decide this. So how do the topmost institutes like LVP, Arvind, PGI, and RPC people, you are there today talking on various forums, how do you expect and how do you train your students and how do you help them out in choosing a thesis topic, a right topic for them? Can I have begin it with LVP, Dr. Murlidhar, from Murlidhar, and then we move ahead in a sequence.
Yeah, thank you, Dr. Prashant. What we do is, let's say for this session, we have about 5 students. And, one of the guiding person will ask, who all be ready to mentor. We have a 5 student. And like each of us, from different specialty, we send out about 10 questions, 10 relevant questions, which are exciting, which I have been working, let's say, for several months or years. And we'll collate all the questions and share it to all these 5, the upcoming students. And here the students makes a choice. It is not other way around. As Vaishali madam, told, students will choose with whom they want to work. They want to work with cornea, retina.
Dr.
and
Muralidhar sir, are you talking about a fellow or a DNB?
DNB. I'm
I'm
talking
talking about a
DNB.
postgraduate.
Yes, DNB, postgraduate. I was a mentor for 3 people, and all 3 were very good prospective studies, able to convert them into good publications. Yes. So it is a DNB student is the one who chooses the mentor. Then once they finalize, I'll have let's say how I chose my mentee. Then you have a mentor to mentee. It's a bi-directional, you go and talk to them, how serious, how passionate, what is their level of understanding. And I'll pitch, what all the potential possible again. And we will, out of 10 questions, we shortlist 1 or 2. And I'll give a time to, the student to come back, do background work. I have my background work I've already done very diligently. I just want to, have a 1 layer of check. If I'm completely convinced, then I'll give a green signal. Yeah, I'll be your mentor, because it's equally a big responsibility. Then we will work, goal, next in 30 days time, we will finalize that potential question. And as Sir was pointing out, it is always a prospective study. And we put a Gantt chart, and the next, 2 years time, how do we, put everything together. So that's how, we go at LVPI. Dr. Rohit, you can add if anything I have messed up.
No, I think Murali, you have pointed out very right, actually. Like, this is what the mentee decides which mentor he wants to go, and mentor also assess the mentee. It's not like only the mentee has decided that this is my mentor, and they are like, the mentor has to go with it. So both of them talk and then come to a consensus, and then see whether he is really able to mentor, because it's a very, very big responsibility. And I think these students who come, they are very raw, and it's the way you mold them, probably, I think, we shape their future career.
I now move to a governmental institute.
Big advantage with us, sir. They have all top ranking students. They come, they're extremely bright, hardworking, and we don't have to tell them. You just tell them one, little information, they'll come with the 10 things. So that way it worked out very, very good in our favor.
So now I come to the governmental institute. Dr. Vivek Gupta, you are representing an RPC. How is your pattern there about helping a student, with a PG teaching thesis topic rather?
So, sir, like these allotment of student to the individual faculty members, it's typically done on a rotation kind of a basis. But the topics, so it is like a question of the students' own interest and their own understanding, if they have a reasonably clear idea of what they want to do. And in case they do not, then obviously the mentors, the faculty, they have usually a set of questions that they have been working on, and they see as potential ideas, in which these are then pitched out to the students. And then, depending on the interest of the student, the literature review, those ideas get shaped, and the topic finally gets decided. So it's a kind of a mutually agreed, in a way, kind of a topic which gets decided upon. And yes, very often these are like follow-up studies of patients, trials, things like those.
So Dr. Kavita from Arvind.
Sir, like what Dr. Vivek Gupta said, in our institute also, it's just on a rotational basis. Neither the mentee or nor the mentor will be able to choose each other. As like all of you said, it's always a prospective study, because the DNB, we have only DNB seats, and the DNB board does not allow retrospective studies. And what usually we do is, like, we will all the like guides who are like supposed to be the guides, with the relevant experience and who are registered with the board, they are supposed to have like their own research topics ready. And as like usually when a resident meets me, like also give them, we also give them the time, and then we would like to know their interest also, whether they have any research questions. And usually I'll ask them to go through the abstract books of the meeting conferences like AOC or a state conference, to understand like what a research question is, like how it really looks like, for them to have an idea. And then like usually we'll ask them to come out with topics, and in case like some people are really bright and they really have their idea, and like they are very clear in what they want to do, while some students might not be to that level, to them like usually we help them with the questions. And as soon as the students join, like we make them attend a basic research methodology course, at least a Monday course, covering the relevant topics like the research study designs, like the role of statistician, like what is a hypothesis, and the do's and don'ts in the thesis. So we have a basic research methodology course, and that is also very helpful for them to understand little basics. And definitely, yes, the guides help them out. And as the board recommends, like we can't give them much time from the date of joining. They are supposed to submit their protocol along with the research committee and the ethics committee approvals to the board within like 90 days from the date of joining. So it's like very difficult for them, especially for the primary DNB candidates, to get acquainted to really what they want to know. As Dr. Vishali was mentioning, definitely the role of the mentor really matters a lot here.
Okay. For PGI, I know the answer, Vishali ma'am. Every PG who must be getting enrolled would be clamoring to Dr. Vishali for being asking her to be a mentor. Then how do you choose amongst them?
No, we have
Because
a
you
limit.
said the mentee decides in your institute the choice of a mentor. So
We
then
have a
everyone who
limit.
wants to have a publication would rush to you.
We have a limit. We can't take more than
That's
6
exactly.
total, which includes PhD and MCH. And since we have MCH in vitro right now, so mine is now kind of restricted, but we can be co-guide. And there are two things, Prashant, I want to say. The youngsters today are very different from our generation. They are getting into the institute, they know exactly most of the things. The first question before deciding the institute, they ask, how many surgeries will I get? What will be the hands-on training? You know, they know everything. So they have a fair enough idea what they want to do. And my second thing is that PG thesis is about teaching the research methodology. It's not about something which you have to follow for the rest of your life. So whatever subject it is, your methodology has to be very solid. Like Dr. Kavita said, that statistics course, we also have 1 month course. They should understand the methodology. They should be able to learn to be honest, the honest research, the research which does not teach them to multiply, which does not teach them to enter false readings. And that is it. Once they learn that, they can expand it to anything else, their passion in the area which they understand is good for them. So that I think is not a big problem. You may be working in oculoplasty and later switch on to uveitis as long as you understand the basic flow of things. And there comes the role of mentor. And I think the most important thing in research is the credibility and honesty. Fine, you did not get results. You say, I did not get it. You know, why fudge the data and try to figure out? And we are all desperate, we all are time bound, we all want thesis to be complete. But I think this is the time when we should accept that we tried and we failed, and we should give importance to negative result in thesis probably more than the positive. That's one thing I would like to change. And the second thing, I think which is kind of the direction we are moving in, I think we will have to step out of this 30 patient randomized to 15 injection, 15 non-injection and chi-scale. Probably time to move in the direction of bioinformatics and that kind of methodology, which is not my domain, but I think the education needs an overhauling with the future. The younger generation, to them, we are not a source of knowledge at all. It is chat GPT. It is deep mind, seek mind, whatever the thing is. So we are just to share our experience and teach them the practical aspects. And I think the earlier we accept that, the happier we will be.
Those are the golden words, postgraduates from one of the greatest researchers of our country. So just lap it on. So Deepak, you are representing again one of the peak governmental institute. What's the state at your place? How do you, you are going to be a director of RIO in another 4 years. So how are you looking at this? Because this particular program is designed so that we really initiate the thought process of doing a good research. As a research means a good thesis which begins a first stepping stone into their research career in their life, and this is the basic aim why ARC has decided these 4 episodes in this month of February. So Deepak, you are
Sir,
the
there is two things. One thing is allotment of mentor. Just like our previous researcher, our place too, allotment of mentors is based on the rotationship. But the allotment of topic is different. Means once the mentor is allotted, then both mentor and mentee work in a such a way. Mentor have to check the interest of the mentee, and the mentee will go for their express their own interest, so that the allotment of mentorship is on the rotation basis, but the topic is jointly uh, taken by both mentor and mentee. In our place, we have one big advantage, that is we are at a university and we have lots of uh, study scopes. Means we can collaborate with IIT, we can collaborate with genetics, we can collaborate with many biochemical researchers and other things. So usually we have one of the chief mentor from the department, and usually we have a co-guide from the another place of the other department, either genetics or the molecular biology or the IIT from the BHU. So we usually do a multi-center, means multi-departmental study or the basic research along with the clinical, and usually the research is a prospective or the cross-sectional study if something is required. Retrospective study we usually avoid to take the topic.
great. Deepak, you can carry forward the proceedings. Just
Sir, one thing is important, that most of the institution, even the residents are saying that they don't know at the time of the submission of their synopsis, or that what is the role of a biostatistician in planning of your study. So already Vivek has written many books on the biostatistics and telling. Dr. Vivek, what is your suggestion on that? Means anyone which is going to plan a study should consult biostatistician when and why? Because most of the time at the time of writing thesis, candidates are searching a biostatic person who can help them in the research and study design. So what is your suggestion on it?
Sir, I think that's a very excellent question. I think one of the primary reason everyone understands is basically for sample size calculation, right? Everyone goes to a biostatistician to say, how many patients do I need? And they often come back to the disappointment because, the sample size comes out to be too big and then it boils down to 30-30, as is often the case. But I think the more important thing is the students get to know that there is a concept of sample size calculation and there is something which is ideal and then there is something which is practical and feasible to do in the short period of time that they are there. Another important role when it comes to is, I guess once the collection starts, I think just when you're just starting out with your chart of findings, with your data chart, go to the statistician one and discuss, is this the right way to actually capture data? If you're using something like Redcap or a data collection platform, it's another story. But if you're using Excel, then you would realize that at the end of 2 years that you are making repeated visits to a biostatistician just to get your data in order before analysis can be done. So that is point number two, I would say. And third point is often, which is less of a biostatistician, more of a mentor, is get your dummy tables or shell tables done at the beginning, because that also gives you an idea how do you want to look your data analysis to look like, which are the tests that you will be doing. So I think these are the three broad steps, and I would request a panelist to chip in here. Thank you.
Thank you.
Deepak, I have a
Adib sir.
question from Dr.
Yes, sir.
Vivek. Dr. Vivek, what's your opinion about the correlation research, correlational, where we have limitations of ethical and practical constraints? So what is your opinion about the correlation research?
Sir, I guess every kind of research has its place. So a correlational research done well, if it is a topic which is relevant, which is interesting, and it has been done in a rigorous manner, the findings are definitely going to be useful. But just, finding correlations for the sake of finding associations, it's like finding needle in a haystack. That doesn't help. So you have to have a rationale for why you are doing the research. I think
But the outcome is very good. If you do a correlation research, at times the outcome is very good. You do prospective research, compare one or two variables, and so that comes out to a very good. And we are working on that very frequently in our thesis and awarding to, because it's a easy task for the resident to understand, and there are not of ethical and practical hiccups are there. So it's easy for them to manage.
definitely,
Yes,
sir.
sir. Sir, Rohit sir, one question from you. Since we all know that LBPI is having a good HIMS system, hospital system, and they have records of each and everything. But there are a lot of medical colleges in India where the resident didn't means the college didn't have any hospital management system or anything. Say, what is your take home or suggestion how they can maintain their data or the findings for the subsequent in a prospective study? What we all have a suggestion that the study or the thesis should be a prospective. So one of the important limitation is to carry forward their study when there is no good HIMS system there. So your tips on it?
Probably, I think if you don't have a good HIMS system, probably the best thing would be to create one, but probably in the interest of time, if you don't have, it takes time to get all the things in place. And especially in government setting and all the approvals and all, it takes time. When the student is at your head, sitting next to you and want a thesis topic and want to collect prospective data, the simplest way would be like to design a questionnaire and make sure that each and every patients which fulfills the inclusion criteria gets the data filled in that questionnaire, probably so that he can have a robust data at the end of the study for at least to write his thesis and do the analysis and write his thesis. And the data can be entered, as Vivek said, in a Redcap, or it can be in an Excel sheet, but probably make sure that data is entered correctly and analyzed correctly.
Vaishali ma'am?
And for the government institutes, Redcap just needs subscription. It's free. You really do not have to pay it for organization. So something which can be done, I don't say very easily, but which can be done without spending the money. Shifting from Excel to database, because when we shift on to these platforms, the data remains our. Students come, students go, they take the Excel charts with them, so we cannot follow up those patients. But if we have permanently the records in whatever platform you use, then it can subsequently be carried on in future also, the same patients.
Okay. So I think we had a wonderful discussion about how to initiate into thesis writing, and today was the understanding the basis of thesis work. I hope postgraduates who had some understanding of how we should approach we should be really thankful to Dr. Muralidhar, Dr. Kavita, Dr. Vivek, and Dr. Vishala Gupta for steering us through this session, an interesting session and engaging session, and really informative for most of the postgraduates as well as to even to us, people like us. Of course, my sincere thanks to all of them. As well, my sincere thanks to all the discussant, Dr. Rohit, Dr. Pandav sir, Dr. Adib Alam Khan sir, and Dr. Sanjay Kumar Thakur for sparing their valuable time and adding inputs to this wonderful discussion. So it's time for us to now say goodbye. So postgraduates will be meeting again on subsequent Thursday with the second part of this particular about how to write a thesis and that is going to be on 13th of February. So till then, let's say bye-bye.
Thank you.
Thank you, Dr.
Yes, sir.
Prashant, and very good.
Thank you, sir.
Thank you.
Thank you.
So,
Thank
Deepak,
you. Bye, sir. Bye, sir. Thank you, sir.
हाँ बढ़ा दिया 15-20 मिनट 9 बजे खत्म होना था